So this beautiful patient, EL, I asked her, what bothers you? So she said, nasolabial fold and this. So I'm going to do the injection of the toxin just for teaching purposes and for her to be more beautiful, but the focus is on this. So on a nasolabial fold like her, you see that if I correct, even if I correct the sides, I cannot correct completely. I diminish the fold. So in cases like her, which is a mild, moderate to severe nasolabial fold, I also correct the perioral area, so the piriform fossa and the skin. But I start by the lateral face. This, you cannot correct with Radiesse alone, dilute only on the neck. This is a structural problem of the mandible, also in chin. So I'm going to give structure to her jawline, not widening her face, enhancing the vertical vector. That means lower border and back angle. And I'm giving the lower projection of the chin that she's missing. So if you see, her chin is good, pogonio is perfect. Here, it's amputated here. It could be a little bit more. And that gives structure. On the other hand, I will treat the elastosis she already have or the lack of support for the skin of the neck at the same time. So I'm going to use 1 syringe of Radiesse Plus or Radiesse non-dilute for chin and jawline, both sides half and half. I'm going to use Radiesse dilute for the neck. So to improve not only this skeletonization she already have, but also to improve the horizontal necklines. But it won't correct completely, so I will need some skin booster here with I don't have soft here, so I'm going to use Revive diluted in this area to correct the wrinkles. And we're going to tight the lateral face with Radiesse dilute. So I'm going to use Radiesse dilute, Radiesse plus, and for the perioral approach, we're going to use Belotero volume and balance in the wrinkle. So you're going to see all the techniques: deep, superficial, layered approach, and then the toxin for last. So I already numbed the points of entrance. I just want to show where they are. So zygomatic, middle of zygomatic, 1 centimeter in front of the hairline. This is where I put my point of entrance.
Yes.
Point of entrance for biostimulation of the face. Angle, 1 centimeter diagonal, second point of entrance. For this, I treat the lateral face with Radiesse subdermal. Pupillary line down, lower border. This is where I'm going to enter to treat the angle. And this connection to the chin. Midline, lower border. This is where I enter to treat, to project the lower part of the chin, not the pogonio. Pogonio is fine. To do the perioral, I do the pupillary line where it meets the nasolabial fold. I'm going to enter with the cannula deep in the fossa, do the Belotero volume, and then I'm going to go with the needle, okay? As you can see, and we're going to have a lot Belotero volume left. So this, I'm also going to enter in this point, but I'm going to go deep to the mordillus, and I'm going to drop 3 points here to give her volume in this area and to give her more blending chin and mandible. Okay, so we start with the plus. Can you give me a 7? No, you don't have enough. Give me the 70 we're going to use for the other Radiesse. It doesn't matter. Yes, thank you. I can use the same.
Okay, with 1 ml the Revive?
Yes, yes, exactly. So this is for the, yeah. So let's do, so I start always lateral face first, deep to superficial. So let's start with Radiesse Plus in the mandible. So let's put structure first, and then we flush with the other. So we're going to start here, and chin. Are you good? I numb already, okay, the points of entrance. So this is radius plus, don't touch the cannula, and I'm using a 22 gauge 70 millimeter because I need to get back here. Why do I choose this point of entrance, right? Why don't I inject directly? First of all, if I go directly on the bone, I'm injecting in the muscle. I don't want any product inside muscles. Muscles are not made to have products inside. That's how I think. I respect the function. So I want to be super fascia. I spend less product, and I give the sharpness and the structure I want. So I start superficial. Okay, lower border. This is important. Lower border, not lateral. Otherwise, I'm going to widen the face. She has a beautiful proportion in the face. I don't want to mess with that. I continue superficial. If, when I trespass the anterior border, I already trespassed the danger, which is the facial artery that is deep there, what do? I tend. The fascia doesn't come with it, just the subcutaneous. So what I try is to glide my cannula as long as it's smooth. Cannot be, otherwise you're rupturing and you're entering in the parotid here or inside the fascia. I don't want that. So this is smooth. And I want to get back on the angle. I don't want to get lateral. I don't want to widen the face. So I do 3 points for a woman equal 0.2 ml. 1, 2, 3. If it's a man, I will put another point here because I want more square. So let's do it. One centimeter here and 1 centimeter up here. I'm going to show you how it looks like. So if you see her neck, here is already more vertically augmented if you compare to this side. Great. No, don't need to. Stay as it is. For me, it's good. What I want to do this is just the transition because I'm going to enhance the border. So it's going to be like a lump and then, so I just want to, so I do microbolus. It's superficial. It's close to the bone, but not subdermal. Still subcutaneous. And then I will do the chin. So normally what I do, I don't want to inject in the muscle. So I try to get as close to the muscle as possible. So I'm going to be super fascia here also. And can you give me the needle again? Now, okay, now I'm here, directing towards the lower border. Pull the tissue up for the product to distribute. And then I'm going to blend both sides towards. So I did one bolus. Are you okay? Mm-hmm. And then I'm going to go lateral and give one trace. That's it. And I used half a syringe for her. Let me try to show her jawline compared to this side, which is beautiful, but here is amputated. Here, she has a good chin, better projection. Let's see about her. Much better. This side was even worse than the other one, the wrinkle. The rest we're going to correct just doing the skin here towards, not only in the neck, but also in the jawline. And the more we correct here, the more we correct there. So all the tightening in this direction will influence the neck. Radiesse dilute.
The loop. The same cannula.
Thank you.
Do you need the...
So don't forget to protect the hair, because you're going to go like this. I don't want my cannula rubbing the hair. I think I did the pinch here, but no. Yes. I thought I did. So this is Radiesse dilute 1:1. My goal is subdermal approach. And I'm going to use half a syringe of the solution, half of the solution, 1 syringe per side of this whole solution, half a syringe of non-dilute per side. So I want to be as superficial as this, but I don't trespass the lateral face. So lateral face, line of ligaments is canthus, zygomatic ligament, mandibular ligament. It's more or less here. So I get to it, my cannula, to the lateral face, and I retrograde with 0.1 per trace. You have to feel the... In patients with acne scar, a little bit like her, she has some ice peaks, you even feel more. It's interesting because post-facelift patients, when you do that, it glides like a... Face. Neck is a nightmare, but face, as the plane is there already, it glides like a butter. If you're not feeling the resistance, you're too deep. You have to feel, because you have to cut through this mass, right? Here, for example, I'm too deep. Can you see that, the difference? Okay, go back and try to break through that. Normally, I use half, so 0.75 up, 0.75 down. How do I inject down? I start here, back to the angle. Then I do the lateral part of the mandible, a little bit the upper neck, and then I cross over to the previous injection. So you go, I'm going to go above the injection I did before, but much more superficial, which will help draw the angle and address the mesenteric ligaments. And you see that I'm injecting very low amount. Very superficial. And I'm going to cross up. So my goal is to wash the whole lateral face with that. See? So I connect the point of the zygoma with the angle. Very superficial. And for some people, you see this area, preauricular, starts getting wrinkly. You can take the same point like this, and you can treat this area. Yes. I normally massage, as I said, for the first 5 minutes. So let's massage a little bit the face to spread the product as much as we can.
Just a minute, it is in my eye.
Wait a minute.
Thank you.
Okay. And let's see how it looks like. So there's not more that saggy. Of course, you had some correction because I did the chin already on one side, so it pulls the anterior neck. And you can see a difference in her face. Wait, yeah, let's put her. So you see an enhancement of the vertical height just by looking at her jawline in this side, and more saggy in this one because we didn't do the radius yet, so it's less volume on this side. And then we're going to move to the volume. Yeah, it's 2250. Yeah, the one I didn't use, that's fine. And for me, give me a big smile. Look at this part of the face. So great, strong smile, strong with this side. Strong, strong. Smile with both sides, yeah. Look at this or this. So you see that you have a tendency of having a zygomatic line here. The light is so strong, much less the other side. And also look how much more natural the smile gets. Smile strong. Than this side. The smile is more lower here, and this smile is more upper here. I like this because it makes patients like her that don't have a volume deficient in the face, but it gives a natural freshness to these patients. Yeah. Okay. Now we're going to get a 50 millimeter with 22 gauge with the Belotero volume, and we're going to give injection. So I'm deep here, almost in the maxilla, and I'm directing to the nose. So I am touching the middle of the ala, and I'm going to give a bolus of 0.1 or 0.2, retract to go in the middle, and give another bolus of 0.1. This is my correction to her fossa. I'm not going to do anything else. And then with the rest, I can do down here. So my injection of Belotero volume here is deep. I want to go deep to the mordulus here. If it's superficial, it doesn't work, sorry. Are you okay? You see the tip of my cannula is deep. This is what I need to feel, the resistance. And I gave 3 small bolus here. What I want to do is to blend this emptiness here to the new chin I added to her. And now the balance. So there's some tips and tricks. Well, balance, no. No, I want I want for the neck. No, I want the balance with the needle. We can do the neck. We can do the neck.
The revive, this is the loop.
Yes, but the balance for the... Look, here I put 1 point of entrance for the neck for you to see how I inject the neck. I also use 1-to-1 dilution of Radiesse.
No, it's this one.
This one. Okay, this is... Do you have another 50 that I can use?
Yes, this is the 50.
Can I use this one and then you give me another one?
You can take another one.
So for the neck, it's easier if you get a shorter cannula. If you get a 70 here, is too difficult. So normally, for my point of entrance, I go backwards. Don't trespass the sternocleidomastoideus. You see that the sternocleidomastoideus is here. I'm going to give a small, tiny trace. Another one. Another one. Now I go frontal. Cross to the other border, to the other side. Look how interesting. It looks like this neck is longer than this one, right? This distance is longer than this one because you're bringing everything more up, and you're bringing this area more up. So it looks like, it's just an illusion, but it looks like this neck is longer than this one, although her face is correctly put. Let's finish the nasolabial fold. So the secret here when you do blanching is to go across the wrinkle. The wrinkle is here. I go across, very superficial, and you make, if you could give me a zoom just here, because it's easier to see the populace. Yes, perfect. So here, really superficial, and you give it a blab. You need to see this. You see the little mini blab. Otherwise, you're not intradermal enough. Or you're not intradermal at all. And when you stop seeing the papilla growing, stop injecting, because the product grows to the subcutaneous. And this is not what we want. Yeah. So this is how we erase or we iron the wrinkle. And for the neck, I like to do soft, but revive dilute is also a possibility. Why I'm not saying to you to do revive intradermal here, because it's going to be like a sausage. Revive really needs to be used under. And here I need subdermal, intradermal. So if you dilute, it works perfectly for wrinkle ironing. Remember that revive absorbs water, so don't overcorrect the wrinkle. I normally go along the line and across the vessels. Actually, with soft, it doesn't make any difference because the spread of soft is round towards the needle, different than balance and intense. So if I do like this, balance goes like this, and soft goes round. It doesn't matter. So if I'm doing balance, I'm going across the wrinkle. If I'm doing soft, it doesn't matter. Are you okay? So expect some edema. This edema can take 2 days to go because of the glycerol. Don't forget that. So this would be my treatment for her. She has a better contour, a better chin and jawline projection compared to this side, and a fresher look, even if you look at the nasolabial fold and how heavy the face is. Okay, now let's talk toxin.
I have a flight in a few hours. Thank you. I didn't know. Oh, we can.
Dilution to 1.
Yes,
Give me
it's
25 units. So, Let's see her glabella. Can you frown for me? Strong. So if you see her frowning, she has a typical straight U. So if you put the line in the lower brow like this and midline, her point will be exactly here for the process. Canthus to the lower border of the brow. So my point for the corrugator will be here. The next one will be in the limbus in the middle of the brow. The next one will be in the pupillary line up here. So those are the basic points, and this one is a support point. For her orbicularis, laugh for me, laugh, no, give a smile. She has more wrinkles in the lower part than the brow. So when I draw the target line, which is here in the middle, I put normally my first point up to the brow in the canthus and 1 centimeter below. I have to take into account that this point cannot be lower than this line. So you draw a line in the canthus to the tragus. If this point of 1 centimeter is lower than this line, you have to displace towards the orbit because it's more risky to get the zygomatic major and give asymmetry in the smile. So she's fine, these 3 points, but I can play with the dose. If I would use 15 units for her, 5 in each point, I can do less here and more in the lower ones. So I can do 3 units here instead of 5. I can do 6, 6. I do more dose where she contracts more, depending on the pattern. For her frowning, she's a moderate contracture. So I have 3 doses for prosters, 5, 7, or 10. I would put 5 for her. Head of corrugator, the same, 5. The tail, I normally use 3. Very rarely in a man, I could use 5. And this point is always 1. For the forehead, elevate the forehead? No, elevate, yes. So she has the aponeurosis, contract, here. She doesn't have any contraction. So I don't do anything in this center, but I do upper, so contract, no, up, yeah. So I start in the first wrinkle, then 2 centimeters up, remember 2. You want natural, not frozen, right? Yes. Natural. So 2 centimeters of distance laterally. Contract for me. What I do is that I just grab for them not to be strongly. So I just put my finger and grab. So this is the danger line. This is the C line, just for us to know the depth. So 2 centimeters to the side, 2 centimeters to the side, 2 centimeters. Then I have to go 2 centimeters down, right? My next point, 2 centimeters down, and then 2 centimeters, 2 centimeters, 2 centimeters. The same in this side, 2, 2, and here 2 down, 2, 2, and 2. What it has to be clear for her is that she has the tendency of the Mephisto. You see? When she do like this, look, do, contract. You see this? Look. If you don't correct this, she will have a Mephisto. Block everything. It's horrible. So you see that I put my points here and here. Okay? Mm-hmm. Okay. The other side. That's it. Now, this is 21 units. No, this is not much more. This is diluted to 1.
Yes.
True?
1 ml.
But in 50.
Yes.
So this is 2 ml. I need half ml here. Do you have another? No.
What, 50?
50 yes. Has to be to 0.5 here. So I'm going to start blocking her forehead, okay, and the orbicularis. Not going to make the same mistake as this morning. So this is 100 units diluted to 2. Every trace in this syringe is 1 unit in this dilution because it's a 50 trace syringe. It's a Luer lock. So I'm going to start injecting. Remember that deeper here, moderately deep, superficial. Not because I'm intradermal, because the muscle is more or less at 2 millimeter difference. I have a 4 millimeter needle. So if I have to go 3, I have to put 2/3 in. If I have to go 2.5, I put half in. And here, 1/3 in. Okay? Okay. So first point, third, inject 2 units. On the upper part of the face, I give 2 units. 2 units, 2 units. On the lower, I'm giving less, because I don't need that much of a block. So this point will be 2, but then 1 and 1. I want you to look at this. You see the oval shape? Let me put her like, you see the oval shape here? Yeah. This is, when you are in the muscle, one of the things you can see when patients have thin skin is the oval shape of the bolus, illustrating the diffusion I showed, that the guy showed in the paper. Mm-hmm. On the other hand, if you see a round, maybe you're in the subcutaneous. But, so here I'm gonna give 1 unit, 1 unit. 1 unit. This is how I would do her forehead. Let's go for the orbicularis. So we said 3, 6, 6. Here I hold 1/3 of my needle in, or half of my needle in, because I need 2 millimeter at least. So half, 3 units. 6 units. I want to, again, for you to see the roundness like this.
You don't see when she's smile how many wrinkles she has?
Smile?
Another inside. No, radial.
Here, I don't have to block. If I block here, it's enough.
No?
Yeah. Two units. 1.
Dilution by half.
Let me take a little bit more of this, and then I go for that one.
I'm putting this like that.
This is to 1, right?
This is by half.
Yeah, half. Yeah.
By 0.5.
Yeah. So let me do one thing, because
Still a little bit? No, nothing.
Yeah.
I took
okay,
everything.
so I that's fine. We do the glabella first, and then I do the other side. So I'm doing her glabella, procerus 90 degrees to the bone, 5 units. This is 2 units per trace because it's more concentrated. So I only put 5, it's 2 traces and a half. What I want to show is this. So she has a smaller orbit. We have to go 90 degrees to the orbit, not to the skin. To the skin, I would go like this or like this. I need to mark the orbital rim and go 90 degrees to the orbit and give the 5 units. I protect here again, and I go full needle in, half a needle in, or 2/3 of a needle in, and here I go 90 degrees, 1/3 of a needle in. And this is how I do the glabella. I'm going to do the last points here. 1 unit, 1 unit. And then
There's a little bit more left by the double dilution.
Perfect. No, there's nothing here.
Oh, okay.
So I put 3 units, 6 and 6. Let me take the rest, the tiny, tiny, tiny amount, and inject in this one. So this is how I did changes in my toxin injection. This is how I mark. You saw me injecting the toxin, and this is how I normally treat patients like her. I advise her that she will need another session, as I showed in the most probably 2 or 3 sessions even, of 1 syringe, half each side. In a month, normally I do, for the Radiesse dilute. For the neck, you see a good correction of the wrinkles already, although is expected to be better, and the pimples will be gone in 2 days, more or less. You look good. That's it.
Okay.
I'm just going to do the other side. Yeah, I showed already.
She will sit? Yeah.
Yes, you can sit. You want to sit? Oops, to the camera. So the face is very different from one side to the other. The neck, you can see a little bit of the laxity here, not anymore in this side. And this is immediately after, so we expect it to be better afterwards.
5.
And Radiesse
Volume.
Plus, this one, right?
Yeah, this is the plus.
Okay.
With
This
the
one.
long, yeah. And if you, yeah.
If you have any questions, please just ask while I'm treating her. You okay?
And somebody make mistake and have some pumps in some days.
Normally, if you have this kind of complication, I ask all my patients of Radiesse to come to respond a question the next day. Do you feel bumps, lumps, symmetries, pain, anything, any injectable? If they say yes, I ask them to come. If they come before 15 days and you have a bump, I had once in the temple when I was using Radiesse non-dilute, you just do saline and massage, or lidocaine and massage. That's it. It distributes the accumulation.
After 2 weeks, nothing to do.
Well, then you have to try, because then you already have inflammation. But you can try hyaluronidase, although it's not to dissolve the particles. It's just to try to dissolve the capsule around. So you can use hyaluronidase. You can use CO2 if it's very superficial. You can use radiofrequency ablative, yes, to break if you have the yellowish look. So that's what you can try to do. If you have really a nodule, like inflamed because of the accumulation of the product, like 2 months, there's a whole algorithm that we published on that. But you can use cortisone, hyaluronidase, and other things that are more drastic. I never had. I had accumulation of product once in the temple, and twice I had, when I injected with needle the neck, I had 2 yellowish look in the skin, which I treated with CO2. That was it. Nothing else. So this is what I would advise. Prevent. This is the best thing.
Another one?
Yeah, for the neck. We're almost there. Felt it.
What do you need now? Okay.
Let's do the Belotero or her.
Balance.
Yes. Here, and then the revive. Last
Oh,
one.
it's this one, yeah. I changed the
Thank you. That's it.
That's it.
I have brought it.
The other side is faster.
Yeah. always when you're not explaining, right? So this is her face treated in both sides. Of course, this side has more edema because the Radiesse has the edema right after. And you don't see so much laxity anymore immediately after, but we imagine that this will be better.
A little bit this.
And this, in this one, you can see better than in that one.
Yes.
Yeah, the colors, right?
Yes.
You can see much better. Any questions, please?
Thank you very much.
No, you're welcome. I like to use the 4, but normally, because I don't have in Spain good syringes for the 4, I use the 6. That comes, the BD6, the ultrafine, this is what I use normally.